Welcome to this webinar on COVID-19 and ongoing challenges in the ecumenical community. I'm Jim Winkler, and I serve as General Secretary and President of the National Council of Churches. Along with Ms. Arpi Kazuian, Director of Youth Ministries at Holy Trinity Armenian Church of Greater Boston, I'll be serving as your co-moderator. I'm grateful that so many people have registered for this event. COVID-19 is a horrific disease. It is enveloping the world with millions of cases and hundreds of thousands of deaths. A cure is nowhere in sight, and a search for a vaccine is ongoing. The disease is challenging individuals and societies alike in terms of social interactions, economic well-being, and community engagement. Churches are also experiencing challenges during this difficult period. The National Council of Churches USA and the Orthodox Christian Studies Center of Fordham University are pleased to present the second of a series of webinars highlighting some of these ecclesial challenges. The discussion today will also highlight how churches are striving to meet these challenges, as well as the opportunity to do ministry together. This event will last 90 minutes and will include some time for audience questions. Our distinguished panelists will speak in alphabetical order, although shortly I will invite each of them to say a few words about our topic. Before I ask Arpi Kazuian to provide logistical instructions to our listeners, allow me to briefly introduce our panelists. Reverend Monsignor J. Brian Bransfield, a priest of the Archdiocese of Philadelphia, has served as General Secretary of the U.S. Conference of Catholic Bishops since 2016. Monsignor Bransfield coordinates all administrative matters of the conference and is responsible for the coordination of the work of the conference committees and staff. He likewise directs and coordinates the planning and operational activities of the various secretariats and offices in support of the work of the conference. Ordained in 1994, Monsignor Bransfield holds a doctorate in moral theology from the Pontifical John Paul II Institute for Studies on Marriage and Family. He's the author of several books, including Life Everlasting, The Mystery and the Promise, as well as Living the Beatitudes, A Journey to Life in Christ. Catherine Mary Laurie is assistant to the presiding bishop of the Evangelical Lutheran Church in America and executive for ecumenical and interreligious relations and theological discernment. Prior to that, she served as Assistant Director of the Pluralism Project at Harvard University, Dr. Diana Eck's research project on religious diversity in the United States. She was a consulting editor for Engaging Others, Knowing Ourselves, a Lutheran Calling in a Multi-Religious World. Catherine Laurie served as the 26th President of the National Council of Churches in 2012 and 13, and was the first Lutheran and the youngest woman to serve in that role. She's edited a book called For Such a Time as This, Young Adults on the Future of the Church, and she is currently co-chair of the executive committee of the Shoulder to Shoulder campaign, Standing with American Muslims, Upholding American Values, a US-based interreligious coalition to end anti-Muslim bigotry. Bishop Lawrence Reddick is the senior bishop of the Christian Methodist Episcopal Church and has been the presiding bishop of the 8th Episcopal District since July 2014. Bishop Reddick is, like me, a son of the parsonage. He is a graduate of Ohio Wesleyan University and Duke Divinity School. He was conferred honorary doctoral degrees from United Theological Seminary and the Bible College of Monroe, Louisiana, and Texas College in Tyler, Texas. After pastoral work in Alabama, Ohio, North Carolina, and Missouri, he was elected editor of the Christian Index, the official publication of the CME Church in 1982. He was subsequently re-elected editor, and during his work as editor, he was also pastor in Alabama and pastor and presiding elder in Mississippi. Bishop Reddick has had many roles, to name but a few. He was chair of the Board of Trustees of Miles College and of Lane College, and was a founding member of the Alabama Faith Council. He currently serves as a member of the board of directors of Bread for the World, where he lobbies Congress in the interests of ridding the world of hunger. His Eminence Metropolitan Nathanael of Chicago is of Pontic and Asia Minor ancestry and was born in Thessalonica, Greece. He graduated from Hellenic College and from Holy Cross Greek Orthodox School of Theology. He earned an STM in Christian ethics and a THD in bioethics from Boston University. Metropolitan Nathanael has also studied the history and ethics of public health at Columbia University. He has served as a guest professor of Orthodox Christian ethics and bioethics at Fordham University, Holy Cross Greek Orthodox School of Theology, and St. Vladimir Orthodox Theological Seminary, a seminary of the Orthodox Church in America. He has authored numerous articles in theology and bioethics. His Eminence coordinated the Archdiocesan commemoration of the 50th anniversary of the March on Selma and represented the Archdiocese on the National Council of Churches Special Task Force to End Racism in America. On February 7, 2018, the Holy and Sacred Synod of the Ecumenical Patriarchate unanimously elected him Metropolitan of Chicago, succeeding His Eminence Metropolitan Iakobos of blessed memory. I very much look forward to hearing from these four thoughtful and distinguished church leaders, and I'd like to ask Msgr. Bransfield to say just a word about this topic, sort of an introductory remarks before we hear from in more depth from our four speakers. You're on mute, Monsignor. You're still on mute. Yeah.
The host, I think the host had muted me, it said somewhere, but
Sorry.
Thank you for this opportunity to be together. What I'd like to speak to is this reality where we see since March and before, a germ is crushing the world. A germ is changing history. And the trauma that comes forth from that has affected all of us in ways we could not have imagined earlier this year. And we find ourselves thrown headlong together in this incredible wilderness, this hurtful place, and we've seen the cascading effects. What I would like to speak to is a direction of healing, a direction of connection, a direction of response together. So thank you.
Thank you. Catherine.
Thanks, Jim, and this is really an honor to be together with all of you. We are in a milestone week, a very sad milestone week where we've crossed the line beyond 1 million deaths worldwide and close to 207,000 in the United States alone. And I want to spend some time unpacking the pandemics that are within this pandemic of COVID-19. I'm surrounded by preachers tonight, so I'm going to use 3 C's to just share briefly. One, I want to contribute in terms of comforting those who are ill and grieving and honoring those who have died. I want to contribute by confronting the underlying conditions this pandemic has aggravated in our society. And thirdly, I want to contribute by condemning the evils of racism, white supremacist ideology, and Christian nationalism, in which the churches have been both complicit and against which the churches must conspire together. Thanks, Jim.
Thank you. Bishop Reddick.
Thank you, Jim, and I'm comfortable if you and everyone else calls me Lawrence. I'm glad to be a part of this panel today. I thank you for the invitation. I look forward to hearing how other church traditions are fielding the issues that arise from this pandemic through their doctrinal and practical perspectives, and to hear how our different demographics are affected. Thank you.
Thank you. Eminence? Oh, you're on mute also.
I think the host may have.
Okay.
There we are.
Yeah, the host has the power. So thank you. I also echo everyone else's gratitude for this opportunity to share some thoughts. And I also express my solidarity and prayers for those who are suffering today. As the hierarchy here in the metropolis of Chicago, I have seen the COVID-19 pandemic bring out some of the worst in us. Some of the things that we thought were long dead in human nature, so to speak, but that were lingering and waiting there, some of the passions that were just waiting for the right conditions to give them life again. And I'm sure that we will all work together to truly exorcise those demons in us. But I really also have seen the best in humanity, and I've seen people rise to the occasion, individuals, but also entire communities really rally and find opportunities for growth and healing. And so I think our work here is an expression of that positive effort to respond to COVID-19 as a human community. So I thank you all for the invitation.
Well, thanks to all four of you. That was magnificent. And before we move further, I'd like to turn to my co-moderator, Arpi Kazuian, for her comments.
Thank you, Jim, and thank you all of you. Good afternoon and welcome. As Jim said, I'm Arpi Kazuian from the Armenian Orthodox Church, and I'm honored to be serving as a co-moderator this evening with Jim and along with all of you. I join you tonight as a former member of the National Council of Churches Governing Board, but just one of the over 40 million individuals represented by the 38 member communions of the NCC. I'm also a lifelong member of the ancient Armenian Apostolic Orthodox Church. As a representative of both the National Council of Churches and the Orthodox Church, I'm honored that the NCC is presenting this webinar in partnership with the Orthodox Christian Studies Center of Fordham University, one of the most preeminent Orthodox academic think tanks in the world. It is my privilege to convene tonight's program with the center's co-founders, Aristotle Telly Papanikolaou and George Demokopoulos, as well as the other co-conveners, Father Peter Bactus of the Orthodox Church in America, Father Nicholas Kazarian of the Greek Orthodox Archdiocese of America, Reverend Dr. Al Moss of the Episcopal Church, and Tony Kyriopoulos of the NCC. Both the NCC and the Orthodox Christian Studies Center wish to thank the Greek Orthodox Archdiocese for hosting this program on its Zoom account. Please note that we are recording this session and it will be available for future viewing. Before we begin, I wanted to briefly review the format for tonight's webinar. We will hold all questions until our speakers have finished their remarks, unless there's something that requires clarification during the presentations. Please use the Q&A, the question and answer feature, to post your questions. During the discussion portion, we will try to get to as many of these questions as we can. Our goal is to allow for 45 minutes of presentation and about 30 minutes of discussion with question and answer. We anticipate ending by 6:30. Along with all of you, I look forward to hearing our presenters share insight on the unique and common challenges we face, as well as lessons learned during the crisis. Having spent over 30 years of my life serving the children and youth of the Armenian Orthodox Church and being married to a priest in the Armenian Apostolic Church, I guess it would be an understatement to say that my life centers around the Armenian Orthodox faith. During these past 6 months, our church has certainly encountered our share of challenges due to the pandemic. But as an ethnic church community that goes back generations, we are privileged to have had the full moral and financial support of our members who have strong connections and deep roots to their ancestral church. Their support has been instrumental in our ability to still be standing after these many months of uncertainty. However, we recognize that this might not be an experience that all other churches have. Tonight, we welcome the opportunity to hear others share their perspective in order to give us a glimpse into the reality of the impact of COVID-19 on other communities of faith. In the spirit of ecumenical fellowship, I want to share with all of you the heavy burden that is presently on the hearts and minds of the Armenian people. Today at 6 p.m., while we're gathered, across our Armenian diocese, a special evening prayer service is being offered for the Republic of Nagorno-Karabakh, Artsakh, as our Armenian homeland is officially in a state of war. I ask that you please keep the Armenian people in your prayers and pray that our all-merciful God brings peace and hope to all those impacted by war. I truly thank all of you for joining us this evening. And now I turn the program back over to Jim Winkler to welcome our speakers and hear their presentations. Thank you.
Thank you, Arpi. And please know that we are praying for the people of Armenia and that the National Council of Churches has been working all day today on a statement that will be released tomorrow.
Thank you for that. We appreciate it.
I'd like to invite Monsignor Bransfield to share his thoughts, and we're so grateful that you can be part of this webinar tonight.
Thank you. I'm very grateful and honored to be here. A germ is crushing the world. A germ is changing history. A germ is generating a storm. And you and I are familiar, most storms have a very defined beginning and a very predictable end. A storm, a hurricane, as devastating as it is, has a foreseeable duration. And that foreseeable duration is one of the things that makes even very intense storms bearable, a foreseeable end. Ash Wednesday was 215 days ago in our tradition. Since Ash Wednesday, we've been flung headlong into the worst epidemiological pandemic of our lifetime, a storm. None of us has been through this before. A lot changed overnight for us in mid-March. We've all learned a lot more about epidemiology, about statistics, about aerosol spread than we ever wanted to know. And we're told that even a vaccine or a treatment or a combination, once it does emerge, may be complex and not completely effective. There's no predictable or foreseeable end. And with no foreseeable end, the storm introduces a very unique turbulence, the pain, the distress, the abrupt disconnections in work, in family life, among our friends. We've had to reinvent all along the way everything we did. We had to reinvent it in March overnight. Everything went virtual. Schools closed and hospitals were overwhelmed last spring. We don't want that to return again. We're worried for our physical health. We're worried about people who live paycheck to paycheck, layoffs, the homeless. We worry for relatives we have who work in healthcare. There are restrictions on our movement, students with their course of study that's been disrupted. We care for elderly relatives. Everyday life is a different season now, and the strain mounts. We can see the public pressures very clearly. We see them laid out on cable news or on Twitter, on Facebook, on the internet, but those external pressures usually trigger our internal pressures. Pressure squeezes us, doesn't it? Pressure squeezes us. And when pressure is secret, it tends to squeeze us all the more. Remember the psalmist, I kept it secret and my frame was wasted. There's an emotional toll. Uncertainty has always been part of the things in life, but never this uncertain. We speak of partial or phased reopenings. We speak of a possible resurgence of the virus, of reopening anxiety. Reopening causes some people to feel relief. It causes others to feel anxious. We're worried about bringing the virus home. We see an accent in depression, in anger, anxiety, marital problems. For all of us, this is not simply a news conference out there or a Twitter storm or an online event. At the Bishops' Conference, in particular, our headquarters in Washington, we identified 4 priorities in March that we've tried to stick to stay with. The first, we pronounced it very clearly and repeatedly, is the health, safety, and well-being of our team and staff. That's the priority. And I said on more than one occasion, our work, our pastoral policy, advocacy, communications, administration work, it's important, but our staff is more important. That's the first. Second priority, we will take the virus seriously, we said in March, as so many did. Third, we want to see to the mission. Pastoral, policy, advocacy, communications, especially administrative, and our IT support, our general services support. When we saw the scourge of racism again and again, so we could respond in ways that are effective and ongoing. The third priority, see to the mission. The fourth was stay connected, communicate with God in prayer first, but with each other. At the end of a crisis, no one says to leadership, you know, you just communicated way too often during that crisis. We had town halls, we had virtual lunches, we had a check-in to see how everyone's doing, status updates, emails, connections, town halls where any question could be asked and answered, didn't have to be submitted ahead of. But now I think as we approach this month, we have to turn to a fifth priority. You know, back in spring, we watched an arc. We watched a curve that we wanted to have flattened. That was the message of the spring. But there's another arc or another curve that might not flatten as quickly, the one of grief and loss. Loss of family, loss of loved ones, loss of livelihoods, loss of jobs. We can't see friends as we did, the unemployment crisis, threshold moments missed, anniversaries, graduations, mental health crisis. There's a lot of loss. Trauma is the word. We have been encountering a very unique form of trauma. Trauma disrupts. Healing connects. Trauma sounds like a strong word, doesn't it? It's about dread. It touches shame from our early life. Everyone has shame. Especially people who say, no, I don't have trauma, I don't have shame. They tend to have more, sadly. They might be in denial. In a study conducted at the end of April, this past April 2020, participants were found to be 8 times as likely to screen positive for serious mental illness. 28% of the participants were likely to screen positive for mental illness, as opposed to 3.4% in 2018. The vast majority of the 2020 participants, 70%, met the criteria for moderate to serious mental illness. 70%. It was 22% in 2018. The sense that some of us may have inside as we go about our daily life, that we are a burden, that we are a nuisance. Leaders can feel this way from time to time. Are we doing things right? We're supposed to have the answers, and there's some myth that leaders have all the answers. And it can lead to a lot of disintegration, to twists, to knots, to our interior life. Some people go for coping to alcohol. It's the oldest medication known to man. Intoxication accelerates us past the pain. The liquid merry-go-round cranks up at 5 o'clock. The ice tumbles down into the glass and just goes along in sad circles. Some people sink into activities. They disappear for decades into workaholism or pleasing others. Some people stare into a screen for years. The screen is the #1 hiding place in the United States. The old saying is that television is simply Valium with a cord attached. And anything we want is a tap away at the tip of our fingers. What do we have to do? Where do we have to go? We have to go to a safe place. And for many, that can be spiritual direction, church, prudent counseling, or safe communities. My sense is, how do we make the priority, and that's really my key theme, how do we make our churches, our communities, safe communities, because safe connection heals. If disruption causes trauma, safe connection in Christ, through Christ, and with one another in the church heals. Safety allows us to do something. We can find our way through patiently and untangle, chip away at, dig around, dust off, and sort through the crusted layers of hurt from the pandemic and from everything before it and around it. I love what someone said, the pandemics within the pandemic. As we do that work, treasures break through. And they slowly emerge from underneath a pile of often formidable emotional debris. We must find support with one another and connection. Even with those in place, we go to Jesus. St. Paul in Galatians, bear one another's burdens. So the picture of grace as prayer. As we walk alongside each other, and instead of compete with one another, we coach one another. Healing is within reach. A germ is crushing the world. A germ is changing history. A germ is causing a storm. But Christ has saved the world. Christ has entered and changed history. And Christ is the storm. How do we work together in life-giving ways for healing and connection? Awareness that so many are suffering in ways we might not know. Empathy, listening, and safe communities. Ash Wednesday was 215 days ago. Easter was 171 days ago. But Easter doesn't end. this storm will end. Easter does not end. If we connect and unite, we can convert the pressure. We can bear it with one another. And we can drive this burden to becoming a weight that transforms us. Thank you.
Thank you so much, Monsignor. That was really insightful and hope-filled. I really appreciate that. And now I'd like to turn to my good friend, Catherine Laurie, and thank you for being part of this webinar.
Thanks, Jim, and thank you, Monsignor Bransfield. You know, on March 11th, when the World Health Organization declared this outbreak a global pandemic, I think it was for most of us the very next day on March 12th when everything changed. And I wonder how many of us have a story that will stay in our minds forever about where we were on that day or whatever day everything shut down in our communities. And we're just living in the midst of so much anguish around the death and illness that has taken so many loved ones from us, people that we call family and friends, our colleagues, people who are even tuned into this webinar who are in recovery from an illness that we know so little about. But in these 6 months, almost 7, this deadly virus has ravaged our communities, and it's laid bare our society's underlying conditions. And so, as I mentioned earlier, I want to speak tonight about the pandemics within the pandemic. I want to say a quick word about the specific responses of the Evangelical Lutheran Church in America before I begin, because I think we really can learn from one another. Our church set up a response fund and received about 1.7 million in a special appeal across the church, and that's to date, of course. About $1 million of that money has already gone in special appeal grants to ELCA congregations and ministries to cover the costs of basic necessities, including groceries for people and their families, and PPE for essential workers, and technology to support online worship and faith formation. And of course, the cost of operations for utility and other rental expenses that our congregations and worshiping communities face. The next round of grants will be distributed very soon. It will focus on addressing the specific needs of communities of color who, as we all know, are hardest hit by this pandemic. We've also worked to develop various kinds of guidelines for those congregations as they return, as they consider how to return or whether to return to in-person worship, depending on their circumstances, one of which was developed in ecumenical consultation. And all of this and other resources are available on our website at elca.org/public health. I'd be glad to answer any questions. But let me return to this topic of the pandemics within the pandemic. I'm going to name 9 pandemics, and I want to be clear, this is probably not a comprehensive list, sadly. So I invite you in the Q&A or in your own hearts to consider what is missing and what are the challenges facing us all in the ecumenical community. Let me start with the pandemic that stay-at-home orders have exacerbated gender-based violence, both its prevalence and its severity. We've seen the reports that there's been a spike in reported incidents over the last year, beginning when many of our communities went into lockdown in March. This includes gender-based violence against women, men, those who are transgender, and gender non-conforming people. And we are seeing, of course, a very particular risk for Black trans women. We've seen how our hotlines and shelters are struggling to meet the need and to adapt their life-saving practices and protocols. Most shelters are reducing numbers and using hotel facilities to provide safety from violence and at the same time to prevent the spread of the coronavirus. Hotline responders are advising people on how to stay as safe as possible at home, knowing that the restrictions mean that that's the reality for so many who cannot escape. In the midst of this, we're seeing a lot of opportunities and ways in which we can advocate together. Of course, the Ecumenical family has long called for the reauthorization of the Violence Against Women Act that's currently in legislative limbo. And we also, many of us, participate in the Thursdays in Black campaign, which is the World Council of Churches' global campaign to end and prevent gender-based violence. So I have this background on, not because I'm confused about what day it is, but to share this as a resource provided by the United Church of Christ as we engage in that work together. The second pandemic I want to lift up is the way in which private healthcare systems have magnified economic injustice, as those who can't afford it have limited access and quality of care. We know that care for people suffering from all kinds of illness is costly, but in the case of COVID, we're talking about testing and treatments, hospitalizations and ventilators, follow-up care, which we're barely beginning to understand. And many people who don't have medical insurance or sufficient medical insurance to properly cover these costs are unable to get the kinds of drugs that they need also, and they are also at risk for losing whatever employment they may have, and because they're not able to go to work. Many who can't afford medical treatment delay seeking treatment, which of course in the case of COVID-19 can be very deadly. And so regardless of our political perspectives about healthcare, we can and should look to Scripture. Jesus disrupted inequities in healthcare by providing healing to those who were on the edge of society. Through his miracles, he demonstrated that health is central to our well-being as individuals and for life together in community. The third pandemic I want to name is that our under-resourced public education systems have provided unequal opportunities for remote learning and contributed to food insecurity. Unequal access to broadband exacerbates inequalities in education, the ability to apply for benefits, and to learn about stimulus supports and more. Churches are already working together to try and help meet the need, offering free breakfasts and lunches as well as school supplies to many school children. And one of our ELCA COVID response grants went to a congregation in Detroit, and they used the grant to set up Wi-Fi hotspots in the neighborhood to provide internet access for children who don't have access at home. And they're doing this in cooperation with the city of Detroit. The fourth pandemic I want to name is the disproportionate rates of infection and death from COVID-19 in communities of color and how that has exposed racialized health disparities. According to the most recently updated CDC report, which came out last week, Black and African American people are twice as likely to die from COVID-19 as white people. American Indian or Alaska Native people are 5.3 times more likely to be hospitalized, and Hispanic or Latino people are 2.8 times more likely to contract the virus than white people. So we know that communities of color are far more vulnerable because of the prevalence of various pre-existing medical conditions that make people more susceptible to this respiratory virus. This is caused by environmental racism, and that environmental racism has placed industries that pollute the air, the earth, and the water, leading to respiratory and heart issues that predispose people. All of this, of course, is exacerbated where there is limited access to healthcare, including testing and healthy foods. The fifth pandemic that I'd like to name is the classification of essential workers has laid bare the racialized hierarchies of labor and our dependence on low or no wage migrant workers. Race and ethnicity are risk markers for underlying conditions that impact health, including socioeconomic status, access to healthcare, and increased exposure to the virus due to occupation. This includes, of course, frontline, essential, and critical infrastructure workers. Let me be clear. Communities of color, of course, are on the front lines of this pandemic in every vocation. They are healthcare workers as well as service providers. Yet essential workers have varying degrees of protections, both legal and physical. Those categories of essential workers with the lowest wage also offer the fewest protections, whether legal protections such as paid sick leave or physical protections such as PPE and the enforcement of social distancing protocols. One example I'd like to lift up is that agricultural workers are not being provided with PPE or sanitary facilities in the field. And so one of our ministries, the Amparo ministry, has teams working to provide this support, including food and masks. And this includes to workers in the fields as well as those who are working to contain the wildfires on the West Coast. The sixth pandemic I'd like to name is the very fact that we're having this conversation by webinar rather than our preferred relational meeting of in person should give us some pause. Most of us are addicted to habits of consumption, travel, and transit that gravely contribute to climate injustice. In a time in these 6 months when we've radically reduced our carbon footprints, we need to make some hard practical decisions about how we can live and work more simply for the sake of creation, which we understand theologically to be included in Christ's salvation. The seventh pandemic I'd like to name is how, just a minute, honey, how our polarized and dysfunctional government is unable to provide leadership that's life-giving and life-sustaining. We're seeing how our government is unable to unite to pass urgent stimulus provisions to support the most vulnerable, to provide science-based information on healthcare in response to COVID-19, and to support voting rights as fundamental to democracy and as a right for all, and to model discourse and debate that reflects an understanding of each person with inherent dignity, rights, and responsibilities. This week, our ELCA advocacy joined together with a lot of other ecumenical and interreligious partners to lift up this challenge. They delivered a letter to lawmakers on key provisions, calling for a new coronavirus stimulus package. And yesterday, these partners joined together for a 12-hour online vigil to not only mark the 1 million deaths, but to push for the essential pandemic relief package by Congress. And then, of course, ELCA votes. Like many of your churches, we have this initiative to encourage nonpartisan voter participation and to call out the suppression of voter rights among communities of color and to ensure that that is prevented. The eighth pandemic I'd like to name is the unchecked discriminatory and militarized police practices targeting Black and brown bodies, compounded by racist criminal justice systems that have led to several killings of unarmed Black and brown people and protest. Breonna Taylor and George Floyd were murdered by a system that we as churches are complicit in both creating and supporting. As the body of Christ, we must confess and repent. We must unequivocally proclaim that Black lives matter. We must call evil what it is and be willing to bear the cost of discipleship. We must continue to advocate for just police trainings and restorative justice systems. And we must continue our work together toward reparations for the murder, violence, and suppression of Indigenous and enslaved peoples to whom we are all indebted, and to those communities who continue to bear this violence, discrimination, and suppression.
I'm in a webinar.
The ninth pandemic, and I'm almost done here, I promise, is that we have these legacies of genocide, slavery, racism, white supremacist ideology, and Christian nationalism that have undergirded the histories of the people who today call this country home. As people of faith, we need to play a significant role in teaching and preaching this founding narrative. It helps us to claim a different path forward rather than the path set by the predominant religious narrative of religious freedom. We need to connect the dots between nationalism, Christian nationalism, xenophobia, anti-Semitism, anti-Muslim bigotry and violence, and the proliferation of hate groups. We need to recognize how every wave of immigration or migration, forced or voluntary, has reignited a racist reaction so that we can see a direct line between anti-Black racism and anti-Asian racism emerging out of COVID-19, as well as the racism and xenophobia against Latinx people and the invisibilizing of Native peoples and communities who are amongst the hardest hit by COVID. All of this is learning and teaching, leading to the transformation of values that each person and creation are made in the image of God. And it's also, quite frankly, it's patriotic. On the day after the President of the United States not only failed to condemn white supremacy, but told white supremacists to stand by, we as churches must loudly join together to condemn white supremacy. Supremacy of any form doesn't stand up against the supreme justice and life-giving salvation that we have received through the gospel of Jesus Christ. Our presiding bishop often talks about the doctrine of justification as a great equalizer against which there can be no forms of supremacy. And last year, the ELCA adopted a condemnation of white supremacy and racist rhetoric. And so as we continue to implement this work, a significant part of it is also happening ecumenically, including through the NCC's Act Now to End Racism initiative. So where do we go? I've named 9 pandemics within the pandemic of COVID-19. There is a lot to be disparaging about, but there's also some ways that we can vaccinate against these pandemics, against these underlying aggravated conditions. The first is to advocate for the COVID relief package together. The second is to vote by mail or safely in person before or on November 3rd. And this includes not only the presidential election, of course, but also our congressional and local elections. We can participate in the census, which is closing out, I think, even today. And lastly, and most importantly, I would encourage us all to study, teach, and proclaim the good news of the life, death, and resurrection of Jesus, who heals every ill. Thank you.
Thank you so much, Catherine. That was comprehensive. I have never thought of all those 9 pandemics, and it's really got me thinking about it. And it's wonderful to see your beautiful little boy there. I'm so glad he can participate too. Lawrence Reddick, we turn to you and await your words.
Thank you. First, let me thank Monsignor Bransfield and Catherine Laurie for those challenging words from both. I'm going to address COVID-19 from the eyes of the Christian Methodist Episcopal Church. And I want to begin by saying a few things about our denomination's demographics. I'm going to estimate CME membership as just above 1 million persons in the US and beyond. Church statistics can be far from reliable, but I believe they can be different from reported, both in positive number ways as well as in negative number ways. Some churches I've discovered have more members than they want us to know they have. We were estimated in 2006 as having 850,000 members, and I know that we have expanded the non-US CME churches on the African continent in such a way that I believe we can justify saying just above 1 million persons. We have 11 active bishops and are divided into 9 episcopal districts or areas of supervision in the United States and 2 countries of the Caribbean, and then 2 episcopal districts in Africa, one covering 4 countries of Western Africa and the other covering 11 countries of Eastern, Central, and Southern Africa. In terms of demographics, the CME Church in the US is primarily, but not exclusively, African American. I would estimate 98% plus in the US. But I am also aware of congregations that are mixed Black-white and a few that are mixed Black-white, Latinx, and or Asian. Another significant factor in this discussion about COVID-19 should relate to the demographics of location. We began in 1870 as a Southern church of formerly enslaved persons in the southeastern and south central states. Between about 1905 and 1920, we began to move into cities in the regions of the Northeast, the Midwest, and the West. Some of these congregations in those areas became among our larger congregations. However, the greater number of CME congregations are not large congregations of 300 people or more, but are smaller congregations in small cities of 200,000 or less, or in small towns, or in many very rural areas. The last significant demographic to mention is age. I would say that most CMEs are 50 years old and older. That does not mean that we don't have a significant group of young people or younger aged adults, but I am saying that the bulk of the people who are the day-to-day constituency of this denomination are senior adults. And I say these things as a person who has served in ministry in this church in the Midwest, the Southeast, the South Central states, and in some of the non-US areas, particularly the Caribbean and Western Africa. I suggest to you that COVID-19 has made for us for great challenges and tensions in the lives of our churches, primarily in terms of figuring the best ways to minister to our constituency and to keep sustaining our operations at our regular or better levels of existence. The denominational call to shelter in came from us as the church's bishops to the church in March of this year. I will admit that it was a hard call for me. I was not one of the bishops leading that call, and I thought at first that we could work around having to shelter in. But as developments continued to worsen, it was obvious even to a slow traditionalist such as myself that this was a very different time. The first big challenge, in my opinion, was convincing the local church leadership, pastors in particular, and some active laity, that it was time to live out our theological position that the Church of God is not a building, but as one of our articles of religion states, the visible Church of Christ is a congregation of faithful persons in which the pure word of God is preached and the sacraments duly administered. Urging pastors and congregations to stop convening in the churches was challenging, because then the pastors and congregations had to find other ways of worshiping that were unfamiliar by and large. Remember that we are demographically older and to a great degree rural. I'll speak for my area, which is the state of Texas and the island of Jamaica. While it was convenient to many in the smaller to larger cities to transform from in-person worship to Zoom or Ring Central or other technological means, it has been and still is difficult for many of those persons who are older and more small town or rural. In addition, the digital divide in the nation, the lack of knowledge about the digital world, as well as the lack of opportunity to access it in certain areas, played significant roles. You don't have the same internet access when you live in rural America that you have in mainline towns and cities, even though they do tell you to go to your computer and download the census form. You don't or may not have the same telephone access when you live in rural America. You may be riding around searching for a signal. Telephone service is often spotty. You're just out there. And most of us do not want to attend a worship service by telephone only. Overall, though, I believe most of the pastors and the congregations are to be commended for how they have learned new tools and experienced things they would not have experienced without being challenged to do so, to learn Zoom and GoToMeeting and other things, and to learn something as simple as learning Facebook. For as one pastor related, his church bought Zoom before he knew how limited his people's access was. And the only way in his rural congregation he was able to continue to worship with them was through Facebook. But it required members of his church sitting down with older members, going door to door, showing them how to download Facebook or downloading it for them, and then showing them how to sign in. Another big challenge has been how to do the business of the church, both local church business and the larger judicatory church. In our case, bishops are required to hold annual conferences of churches and to receive reports and assign pastors during that conference. For us, annual conference has been a 4-day affair of business and services. This time, we streamlined it, did a lot beforehand with foreplanning, and made the annual conference a 1-day meeting that began at 9 o'clock in the morning on Zoom, with some on their phones, and ended about 5:30, with breaks planned every hour to an hour and a half. And we had to move our larger national and international meetings to Zoom as well. Now, however, there is a newer challenge of the last month or so, as people are more and more anxious about when do we go back into the churches. And that is now exacerbated by the fact that most Anglo churches are opened up, as many of ours are still sheltered in. Remember, the virus is said to affect our demographics more seriously. We are older and we are people of color. And yet, one of the hardest things to do is to convince some of our pastors to continuing sheltering in until we at least get through this flu season. I liken it to what one of our sister denominations leaders has said, Bishop A. J. Richardson of the AME Church. He said it's an act of love for us to shelter in at this time, to continue to give our people the care they need. If I'm right in my counting, we are now in the 28th week since we urged our congregations to move worship to online services. Many have been worshiping on Zoom or conference call lines. A good number of them are worshiping with drive-in services on the church grounds. But we have a few churches who persist in saying they have few enough people that they are social distance when they go into their church building. And they say they will wear their masks. So why can't they go back to worship as usual? I'm also responsible for the work in Jamaica, and they also are having very, very limited social distanced masked worship. And I can't go there unless I'm willing to quarantine for 2 weeks once I'm in the country. But then in Jamaica, they want all people my age to stay quarantined. Last, let me say that the rush to open is not everywhere. There are some churches or areas that have experienced COVID-19 deaths or aftermaths, such as a person who now must carry his oxygen with him every day of the rest of his life, or the person who has new heart issues after COVID-19. And those who know of some of these issues discover that they are sufficient enough in their knowledge that they want no part of rushing in. One of our bishops related to me that in his area in the rural Southeast, they have seen a lot of deaths. In Texas, we have lost 2 pastors in Southeast Texas, one in Houston and one north of Houston in a very rural area. And the reality of death makes a different argument. These are just some of the things I've shared to you from our perspective. And I'll end here. Thank you.
Thank you so much, Bishop Reddick. It was wonderful to hear just from the perspective of one member communion of the NCC, how you all are grappling with this. Before I turn to Metropolitan Nathanael, I wanted to remind you that if you have questions, please put them in the question and answer box, and we'll get to those. Your Eminence, so glad you could be with us.
Thank you, Jim. And if you'd like, we can go straight to questions and I don't have to offer anything, but I want to echo everything that the others have shared this evening. It's very difficult to go last in these types of discussions because you hear what others have said and you're like, oh, that's on my list of things to say. But I do want to, again, thank you for the opportunity to join the others and to learn from them and to learn from the questions that we'll receive very soon from those who are joining as participants. So as I was trying to prepare for this webinar, I thought of going to one of my parochial schools today, visiting the school and seeing how they have opened up again and to see how what the children look like, where they are emotionally, spiritually, physically, see how the teachers are coping. And so I visited one of the schools. I was quite impressed by what I saw. Smiles all over the place, of course, precautions everywhere, drop-off zones on campus, staggering how children are entering, masks being worn, hand sanitizer everywhere, plexiglass dividers in the classroom. Even the little children in the preschool and the kindergarten classes were so well behaved. Usually when you walk in and they rush to hug you, but they were also adapting. And so I was quite impressed how far we've come since March. Then I came to the office and I asked to see some of the emails and letters that we've received along the way since March 15th in particular, which was a very difficult day for me. Probably one of the most difficult decisions I've had to make thus far in my short tenure as a Metropolitan was to suspend services that day, that Sunday. And so as I began to read through the stack of emails and letters, I realized that our people back then were very angry, afraid, a lot of anxiety, a lot of emotion. Some of them were relieved, some of them were thankful, but you can see that our church, our people, our parishes were not sure what to make of the pandemic. And so they were looking for guidance and advice. And I would say that one of the greatest experiences that I have felt as a hierarch and as a shepherd, as a pastor, is the strengthening of the bonds between myself and my brother hierarchs, the other metropolitans of our archdiocese. The Archbishop, our new Archbishop of Photos, has convened our synod, I would say, over 10 times since March, virtually. I mean, no one in the Orthodox Church, you have synod, and it's a very formal process. It's a very formal gathering of hierarchs, and we could not gather in person since COVID, and so we have all agreed that we can convene now virtually. Everyone's doing their work virtually, and so can we as a church. And so the bonds between the hierarchs of our archdiocese have strengthened. We are meeting more often. We've worked together. We've disagreed and argued with one another more than in the past, but we've learned from the different experiences across the country. The experiences in the Midwest are very different than the experiences in the Northeast or in the South. So we've learned from one another. We've given each other the space to be able to make decisions that would benefit the local community based on the conditions on the ground. But beyond the strengthening of our own bonds within the Orthodox Church, I would say I have grown in my relationship with our ecumenical partners, our friends within other churches, and even throughout the different religions in the Chicago area. I mean, in particular, working with the Wisconsin Council of Churches, the Minnesota Council of Churches, the Council of Religious Leaders of Metropolitan Chicago. We have worked so well together, learning from one another, sharing resources, ideas, and challenges. And in particular, I did want to highlight and express again publicly my gratitude for His Eminence Cardinal Supich of Chicago. I mean, he has been, as I say to him, he served as my big brother or my older brother here in Chicago. He embraced me from my first day here, and our work together has increased exponentially. He has given us access to the resources of the Archdiocese at any time, and we've done incredible work together. And early on, when I've had to make decisions, I consulted with experts, the physicians, the epidemiologists, the nurses, and so forth, to be better informed about what we were dealing with. But then when I needed to make decisions, I often turned to him. He has a heavier cross to bear than I do. He has hundreds of parishes in the area, and I would consult with him after speaking with the brother hierarchs of our archdiocese. I would also turn to him to see what locally is he doing. And so I feel that the COVID pandemic has brought all of our communities closer together. The ecumenical community has grown stronger. Some of the challenges that our people have faced early on, and I think, again, and it's easy to, hindsight is 2020, and it's easy to play Monday morning quarterback to kind of look back and see what mistakes were made by our elected officials. But I would say one of the most hurtful thing that our communities have felt is not being considered essential. I don't know how many messages I've received early on. Why are liquor stores considered essential businesses? Essential for whom and why? And why aren't churches and houses of worship considered essential? Why aren't we treated with respect? And we have all worked, I'm sure the various participants and fellow speakers today have worked to try to bring this issue to our elected officials. And thankfully, over time, they have realized that you cannot keep people safe if they can't worship, if they can't express what's in their heart, if they don't have an outlet, if they don't have their faith, they can't practice their faith. And so, fortunately, the local officials, local and national on all levels have realized that churches and houses of worship must be considered essential. It's been a challenge. I will say that one of the challenges and the difficulties to get there have been some local communities that have had a total disregard for public health and safety of their neighbor. And early on, especially, I think they felt a need to express their rights as citizens, as the rights as a faith community to gather and worship, and that was somehow more important than the safety of the public or the safety of their neighbor. And they have sometimes done things that were irresponsible. And so I think our elected officials have then at times overreacted or responded in a way that have negatively affected our communities. And I'm really glad that that has, at least locally, diminished or it's become insignificant, where all of us, all of our communities recognize that we definitely need to have the ability to worship, but we have a responsibility as Christians to care for our neighbor, and especially the most vulnerable. And it may mean sometimes restricting myself so that the other has the ability to be safe and also enjoy his or her life without fear. I have learned or have 4 main areas or principles that I've looked at or come away with from this COVID pandemic. And I'll share those with you. But I will say that this isn't the first time that our country has experienced the pandemic. Obviously, nothing on this scale, nothing on globally on this scale. But several years ago, we had the H1N1, or the so-called swine flu virus, H1N1 virus, and the disease it led to. I think we dropped the ball back then as communities of faith to kind of rally, to come together, to learn how to respond to these pandemics. And I think we all agree that this COVID-19 is not the last, the new novel coronavirus is not the last virus that will impact us in this way. Hopefully we'll be better prepared to respond. We will have an ongoing dialogue, sharing of our resources along the way, so that as houses of worship, communities of faith, we can serve our people and our neighbors better during the next pandemic, even though we're not completely out of the, done with this one. But the four principles or priorities that I have kind of identified, and these shift over time, and they probably will shift again in the future. The first is safety, as the good Monsignor mentioned. Safety is top priority. Protecting our people and our neighbors is of the utmost importance. We, as a metropolis of Chicago, have made this kind of the starting point when addressing issues, when reopening up our churches and reintroducing the full scope of our sacramental life. We have found ways to celebrate the services and the sacraments in new ways, in safe ways, limiting as much as we can, mitigating risk as best we can, without necessarily deviating from the essence of our faith. But safety in our office space, in our worship space, is number one. Number two is adaptability, or pivoting quickly. The need for our churches to be able to pivot. Christianity is 2,000 years old, and we have these long-standing traditions. And tradition is very important for our people and to our people. But we've tried to adapt, to pivot, to find better ways of channeling our energy and resources. And the third priority kind of is connected to that, and that's responsibility, or being better stewards of the limited resources that we have now. So pivoting and putting aside some of the things that we thought were important, and now finding better ways of utilizing limited resources, restructuring budgets, time and energy being better utilized, not consuming the resources that we have because we don't know what tomorrow brings. And so being better stewards of the many gifts that we've received from the Lord. And finally, I would say it's community. And I began by talking about how our communities have grown, the relationships between our communities have grown. But really now, community for us, especially us as Orthodox, we tend to be very insular. Our people forget that we're in the world, we're not of the world, but we're here for the salvation of the world. That we're here for each other, not just the Orthodox. And so defining the community as broadly as we can, thinking of Acts of the Apostles, Acts 11, I believe, when the Church of Antioch helped the Church of Judea, of Jerusalem, when there was a famine, sending resources somewhere where it was needed. We have food deserts in our major cities. And our church, our metropolis, and our archdiocese we've helped, or we've done the best we can to not only help our own parishioners who are struggling to pay their bills, to put food on their table, but non-Orthodox Christians going into neighborhoods that we never thought we would enter, working with aldermen, working with elected officials to go into these underserved neighborhoods, working with pastors to bring food to people that we never thought we would ever be reaching out to care for. And so I think that we need to continue to do that. It's a challenge for us as Orthodox Christians to do that, for our church to look beyond ourselves more and more. And by doing so, I think we would be a more authentic church. So I'm really grateful. Again, our archdiocese has given resources. I believe we've given over $600,000 in aid. Our metropolis has given over 160,000 in local aid, aiding efforts that are not necessarily those of our archdiocese or metropolis of the Orthodox Church, but helping others help others. So, contributing to the relief that's brought by networking and supporting worthy causes and local churches. That's all I want to say. I know I had 10 minutes. I don't know how much I've spoken, but I hope I didn't go over, and I look forward to the questions that we'll receive. And again, I thank you all for the opportunity to stand virtually alongside you.
Thank you so much, Metropolitan Nathanael. I know that just a couple of quick thoughts. That one is I recognize that I have done less travel this year than I've done in any year in the last 40, which is just remarkable. And while I've missed being in the presence of many of you and so many others that I relished, there has been some degree of respite that I have welcomed. I think I've seen Bishop Reddick perhaps more frequently through the faith table calls than in the past. So there's also been a closer connection. And Metropolitan Nathanael, you talked about working more closely with councils of churches and other ecumenical leaders. And part of that is because of this remarkable change that we're experiencing. I did want to put a question, though, to you all. So much of our life is centered in the physical buildings, as Bishop Reddick mentioned, that is now dramatically changed. I've only really gone to my own local church because my wife is the office manager, and so I'm over there, but far less than I used to. And I'm aware that many churches have experienced a decline in giving. And while our churches have had to adapt and found new ways to be worshiping communities, something about us being physically together engenders, perhaps, I don't know, financial support in a way that it hasn't perhaps done over these last few months. So I wanted to put a question to you all, and I invite any of you to answer. Have some of your congregations closed, or do you anticipate that that may happen as a result of these changes? I know that can be a sensitive question, but we are talking about the challenges of the ecumenical community. So I invite any of you all to respond if you'd like to that.
I'll respond that. Oh, I'm sorry. Go ahead, Catherine. I saw your hand.
Catherine, how about you answer, and then we'll ask Lawrence to share his thoughts. You're on mute there, Catherine. Okay.
Thank you. I am sure, Jim, that the ELCA will mourn the loss not only of people to COVID, but also some of our congregations. The flip side of that story is something I want to name that I think is perhaps more than anecdotal. I happen to know some stories related to the congregation my husband serves as a pastor of, but once they figured out how to do things a bit online, and it's still pretty clunky for many of our congregations, they're finding that their worshiping communities are actually expanding. And it's creating a new kind of challenge, which is perhaps an invited challenge of how will we continue to engage people who may not be part of the community yet, or in some cases may not even live anywhere near the congregation that they're visiting online on that Sunday. Reflected with that is the reality that we are then seeing in some cases increased giving, because some of our people are signing up for these automated online giving programs, or they're giving to congregations that they visit that they might not be able to visit in person because they're church hopping on Sunday morning. I've really experienced the true joy of being able to worship ecumenically on a Sunday morning, going not only to my own congregation where I'm a member, but also to congregations in many different Christian traditions. So just wanted to name that flip side of the conversation too. Thanks.
Excellent point. Excellent point. Bishop?
I think I would echo really what Catherine has said, both in terms of more people attending through these technological means, and also some churches are experiencing increased giving. But to your direct question, I think I can count a couple of churches in a certain part of our Texas southeastern area that are going to have a hard time continuing. I learned one of them is not meeting at all by any means, and to be honest, it blew my mind. And I blew my top. But we've tried to encourage them in terms of encouraging the pastor to do something, even if that means calling the members individually and having some kind of spiritual nourishment for them.
Thank you. Thank you. Yes, Metropolitan.
I would just say that I agree with what the bishop said, and Catherine, our people have stepped up and have increased their giving. We started a parish relief fund, the COVID parish relief fund at the Metropolis, to assist our parishes. And, you know, through small gifts really, and through the generosity of churches that were in a better position financially, we've raised over $250,000, and that aid will go to support our churches, you know, that are struggling. They might have been struggling before because they have small communities, small congregation. But now COVID has really impacted their ability to kind of pay their ongoing bills. But the great thing about all of this is that even though our parishes, you know, are struggling across the board, they have to pay bills. They haven't stopped giving, and I think their charity has increased. The amount of food they're distributing, the amount of aid that they're giving to their neighbors has increased. So we're very, very fortunate that, number one, our people are giving more, that churches are supporting each other, and that even the smallest church is helping its neighbors. So overall, the spirit of giving has increased during this time.
I would concur. I think we would all have the prevailing sentiment be the last resort to close the parish due to COVID, the absolute last resort, exhaust all other options. But the good challenge does emerge how to continue, as the panel has said, to reach out to those that we find now reachable through technology that we might not have had before. How do we, after a good vaccine and a good treatment is achieved, how do we continue that outreach? We don't go back to leave behind what we've gained along the way in terms of the technological outreach, but we seek to consolidate it, hopefully.
Thank you. I'd like to Arpi, if I may.
Yeah,
please.
There are a couple of questions. One is actually, it was one of the first questions we received when the Monsignor was speaking. And it asks about almost the balance between our need to reopen with financial survival and how we justify ourselves to the families of those who have lost family members. It says, how are we different from those who have placed the economy over human life? This question did come up when Monsignor was speaking, so if you would like to answer that.
Certainly, and I'd certainly invite my fellow panelists to offer their wisdom as well. I think certainly, as was said, the reality of death, I think Lauren said, the reality of death makes a very different argument, a very difficult argument. And I think different regions are impacted in various ways. I think our goal is to take all the precautions we can for all the good means to keep each other safe, to open up in the best way we can while keeping people safe. It's very, very delicate balance, but I think we do have to err on the side of safety for people, especially vulnerable people. And at the same time, look for programs, look for aid, look for coming together to sustain people who are experiencing bottomless hardship after bottomless hardship economically. We can obviously come together and go deep into our resources to support one another in that way. So I would like to see deeper efforts there to support one another so that the financial burden is less distributed on one particular group or along a certain demographic, and that we are able to stay as safe as we can. It's very difficult, but as we come together, we can bond, and the strength of that unity can open new places.
There's another question that we talked about the church not being considered essential, and the essential workers, and how other places have opened and churches weren't. Sort of speaking about the message that a lot of our clergy and those who work for the church are really essential workers. And the question that was posed is, how do your pastors, I'll extend that to all our church workers, find spiritual sustenance during this time without getting overwhelmed as they help so many people grieve, work overtime to minister to them in new ways, and worry at the same time about the safety of themselves and their families? If anyone would like to speak to that.
I will say that I know it's hard. I have had some responses from pastors and family members about how difficult it is to, quote, keep the faith. But I also know it drew more out of me at this time. I suddenly, and that's why I said this is the 28th week, because I started a weekly e-blast that I had not done before, primarily thinking about nourishing those who are nourishing the others and asking them to contribute to that weekly e-blast what they are doing in their own ministries to shore up the membership and the community and also for themselves. And I think that is some help that has helped them become more introspective and at least realize they're not alone in this.
Yeah, I'll just say that, I mean, I think that it's extremely difficult to be a priest during normal circumstances. Our priests are really overworked. They suffer from burnout and stress. You know, I think, you know, as a hierarch, as a metropolitan, I suffer. I have a hard time refilling my batteries. I think it's not just on a parish level, but also on a hierarchical level. I think we've emphasized, you know, priests being there for each other, calling each other. I try to do that myself, to just call some of the priests randomly. But again, hierarchs being there for each other, it is very, very difficult. And I think we need to do a better job of caring for the caregiver. We forget about the caregiver and kind of always focus on the person who needs care in the parish. But I think the caregiver, the priests, the pastors, the bishops need help too.
Thank you.
Catherine? You're on mute, Catherine.
Yeah, I want to add one small thing to what His Eminence just said. One of the practical things that many of our synod bishops and even our presiding bishop have done to provide some support and care for our pastors and rostered ministers, including our deacons, is to record sermons that can be shared and can be give the opportunity for that rostered minister to take a vacation day on a Sunday and to take some time away, for a longer number of days. Of course, that bumps directly into what Senior Bishop Reddick named in terms of technological capacity and access. I know my own spouse, he said, well, this is wonderful, but I don't know how to link this into, any form of service. So what do I do with this? But we can figure out as we go along more and more ways to resource that.
The wisdom of the desert fathers and mothers would be watch yourself in any situation. Pay attention. What's entering the heart? What's coming out of the lips? Where are my extremes? Where's my mood? Where are my triggers? Where are my impulses? Where am I overreacting or underreacting? The good self-knowledge. I think that goes in any age. It goes especially in a pandemic. God was here ahead of us, and we can cling to Christ in this moment and in ways of praying, ways of connecting with one another, to watch ourselves and look at the extremes, note them, be aware, and talk them out with a trusted person. When you let light and air into those secrets or impulses, healing can result, but it's very, very important in a safe place to do that. Yeah, and now we might not be able to do it face to face. We have to do it in another secure way. But I think in any time, that's the key advice. Watch myself. Where are my extremes? Note them, share them, invite the grace of Christ in there in a step-by-step manner, and not expecting huge results overnight.
There's one final question before we wrap up. And I'm going to end on a little bit of an uplifting question, because I think this is something we've all experienced, that during this pandemic, I think we've obviously experienced many challenges, but somewhere along the way, we've also learned new ways to do ministry. And I think also have found some blessings that we didn't imagine that we would find. And I think one of them is, and we've heard this from many people, that the church, we've learned or reminded ourselves that the church is more than just the building, that the church is its people. So this as something if you want to just take a few moments to speak about what are some of the blessings that you've seen throughout this pandemic. If you want to each perhaps take a moment to share what that might be, just to help us end on an uplifting note about, yes, this has been a challenging time, but as children of God, we have found a way to take what we have and use it in a way to help one another and to be there for one another. So if anyone would like to take a moment to just share, what are some of the blessings that you may have encountered during this pandemic?
I'll start. I have seen the least finding ways to give more. One of the letters I was going back over this morning was about how a church continued to give to children and family services in a way that just blasted the mind of the social worker. And she wrote a letter glorifying God for what this church had done. I've also seen on a personal level the goodness of respite, as Jim mentioned. I did not realize how tired I was from going. And it's given a different balance to hearing, as the Desert Fathers, Monsignor, would urge us to hear.
I would add.
Oh, go ahead.
you in fact saw part of it, the precious time with family. Even though we are some days at our worst, it is a true gift to participate in the vocation of family. And I have experienced so much joy in that time together. Also, the study of scripture that I'm doing much more regularly, in light of the fact that I'm not meeting in community. I'm taking advantage of the time to seek solace in scripture and study, and that has been life-giving. And then, of course, I think all of our ecumenical initiatives, which have really been a beacon of hope in this world, that have continued and found new ways to give us a sense that our movement is continuing even when we cannot be present in person with one another, and that we can continue to point people to Jesus Christ through new ways and new means. That is such a gift.
For me, and this would be very personal, just others might not be able to relate or share this experience, so I in no way say it as normative. For me personally, not going into the building that we have here, I'm here in my 2 rooms here with a house with other priests. It's reawakened an access to my childhood faith, the faith that I learned by the time I was 5. I mean, we've all studied advanced degrees in theology. We've done great papers, seminars, read things in other languages, everything. Everything that's getting me through now, I learned up to the age of 5. My mother and father's faith. Now I know that's very unique. My mom and dad, they would tell us stories. They lived through the Great Depression as children. My father went away to the Second World War. My mother lost children. Their faith that I saw by the time I was 5 is what's been reawakened in the past 6 months in ways I never knew. I mean, we have all this advanced, not books over here, books over there, and papers and articles, and it's the faith up to the age of 5. Now, not everyone maybe had that same experience, but they may have another comparable experience. But for me, it's recognizing my father kneeling by the side of his bed and my mother reading the Bible, and realizing in my 5-year-old eyes, those things last. What is earliest lasts longest. And that's grace for me. And I hope all of us can find our unique grace. God has been here ahead of us. He's opening doors we had forgotten about. And he's doing it. Unfortunately, there's a lot of pain. Remember, a person in the gospel suffered 38 years before he met Christ. And we would all trade places with him on that 38th year. But what about 5 years in, 8 years in, 10 years in? Well, the storms go long, but Christ is the storm, and he opens things we had long forgotten.
If there's still time to contribute, Arpi, yeah.
Of course, absolutely.
I think for me personally, what's been a great blessing, obviously the slowing down and noticing the presence of the other, and how important other people are in our lives, and for such a long time for such a long time worshiping without the laity in the church was extremely difficult. As a priest or as a hierarch, blessing an empty room. When our people came back, I realized how precious the presence of the other is in our lives and how necessary it is. So not to take the other's presence for granted has really been a lesson I learned.
Arpi, would you like to offer any closing thoughts?
I'm just grateful that I was able to be part of this. I think there's such comfort in knowing that that we're all experiencing this, even though everyone's experience may be different, that the entire world is experiencing this. And I think even though it's painful and we know that it's such a challenging time, there's comfort in knowing that we are in this together, and that it helps us to realize that you know, and just on a personal note, I have a daughter who started college this year. And of course, the college experience was not what any of us expected. And I, at least once a day, I say, but it's not just you. And I think knowing that we are in this as Christians, we, you know, we celebrate together and we suffer together. And I think that nothing is more true than that right now, as we are all going through this together. But I know a number of times I heard like the focus on the other. And I think that's just such an important part of what we're experiencing. But I thank you all for your time this evening and for allowing me to be just a small part of it. There's just really been it's been a comfort for me, and I thank you all for that.
Thank you.
I want to add my thanks to all of our panelists and to those behind the scenes who have made this webinar possible. Notwithstanding the enormous suffering that has taken place and is taking place, the challenges that face us, the pandemics, as Catherine mentioned, that plague our society, I am grateful that we were able to identify some hope in this conversation. It has energized me, and I do think that in fascinating ways we've actually come together. I know for me, I have seen my 1-year-old grandson almost every weekend, and had I wouldn't have seen him that way because I would have been on the road so much. It's a small blessing. It's a huge blessing for me, but it's a small blessing in the wake of all of this. And we have been able to find blessings, although we've grieved and continue to grieve, and the divisiveness that plagues our society is profoundly troubling. As I say, in the midst of this tremendous sadness that we are finding ourselves in, we've yet found ways to cope. And I'm grateful for your leadership as in each of your places where you work and where you minister to help our people find their way forward. There's so much that still awaits us and confronts us, but as I said, I have found hope here, and I give thanks to God for each of you and for all who have been part of this webinar. I hope you too have found some wisdom, as I have from what we have heard. And I wish you well, and I now close this webinar. Thank you again, and I hope we see one another soon.
Bye-bye.
Thank you.
You all.
Thank you.
Bye, everyone.